Hi guys, I'm so sorry I'm late. Let's start working on this project soon.
Wait, guys. First, look at this nurse. They just posted a video about some campaign. I think it's called the Hear Her campaign. Have you guys heard of it?
No, I haven't.
Oh, okay. I'll just share my screen so we all can watch it.
My name is Rennie Joseph. I actually am a clinical instructor at Rutgers University, and also I work at Hackensack University Medical Center in the maternity department. Yeah, so, there's this thing called implicit bias. It's where we unconsciously treat patients differently, and we're not aware of it. So they've shown like rates of maternal mortality are 3 to 4 times higher in Black women and 2 to 3 times higher in American Indian and Alaskan Native women than in white women. So bringing awareness to this, also being more culturally competent. And there are so many other barriers. People don't have insurance, right? They might not have enough income to buy food. So there's, right? Then the baby gets malnutrition too, right? You're not gonna have a good pregnancy. And then also unstable housing, and then transportation, right? Getting to the doctor, right? If you're not able to get to the doctor, some things cannot be diagnosed. And then you get complications, for example, blood pressure, right? If it's not diagnosed and the patient doesn't know, she can actually, right? Die from the complications if it's not caught enough early and monitored early. And then some patients, there's language barriers, so they're not getting the education that they need in the proper way, right? Or there's miscommunication. So there's, there are many barriers, even postpartum follow-up cares. There might be barriers associated with that. There's lack of mental support and sometimes limited care available. Headache with changes in your vision, headache with epigastric pain, and these headaches are like severe. You take medication, they don't go away. If you have swelling on your hands and face, those are most related to blood pressure, so those you don't want to ignore. Shortness of breath, chest pain, those are things you don't want to ignore or dismiss, just seek help. Trouble breathing, severe nausea, throwing up, severe belly pain that's not going away, fever, overwhelming tiredness, heavy bleeding, where you're soaking like more than 1 pad every hour, passing clots size of an egg or bigger, or even if you're, that's more postpartum. And then even if you're pregnant, right, if you're having bleeding, you should reach out to your doctor, or your baby is not moving or as much or stopped moving. Those are other things. I don't know if I mentioned fever, but fever too is something you definitely want to get help for.
Okay, so after some research, it says the CDC's Hear Her campaign aims to reduce maternal mortality by increasing awareness of urgent pregnancy-related warning signs and providing tools to improve communication between patients, their support systems, and healthcare providers. I think the topic's actually pretty interesting. Y'all want to do some more research?
Yeah, I see here, and along with what you said, the primary audience for the Hear campaign and the video would be all pregnant individuals as well as postpartum women, but more specifically those at a higher risk of maternal health complications, such as comorbid genetic predispositions, if they're African American, as well as Hispanic women. This would also include those who support them, so spouses, partners, family members, and friends, since these individuals are most often the first to notice these warning signs in these women. And I think the secondary audience would be the healthcare professionals who interact with pregnant or postpartum women. Wait guys, looking into this now, this is such an important topic since it says maternal mortality rates, or MMR, remain at unacceptably high levels in the US.
And what's even more shocking, they also reported that more than 80% of those maternal deaths were actually preventable. Isn't that insane? With the Hear Her campaign, we are highlighting the need for quality improvement initiatives in states, hospitals, and communities to ensure all people who are pregnant or postpartum get the right care at the right time.
What are some of the statistics?
So here, according to the World Health Organization, about 260,000 women died globally during and following pregnancy and childbirth back in 2023, but I'm not so sure about nationally.
Wait here, I found some more stats about maternal mortality. According to the CDC, with the latest data being in 2024, they said there were about 646 deaths, which means it was about 17.9 per 100,000 births in the US. So I'll screen share the graph real quick. So in the graph, like it's the peak is in 2021, but it went back down in 2022 up to now.
Wow, that's a lot of deaths. Is there any more statistics on this?
Yes, I actually have more statistics on this, but these statistics are more alarming, specific, and concerning.
Okay, before you get into any other statistics, let me identify our target population for the project. So, according to all of our research this far, our hot topic targets pregnant and postpartum women who fall under the minority population. These include Hispanics, African Americans, and other women of color. Do you have any stats that prove this specifically?
Yes, I do. In the US for Black women, the rate of maternal mortality was 44.8 deaths per 100,000 live births, which is 3 times higher than the rate for white women, which stood at 14.2. And also more locally, data from the New Jersey government states that in New Jersey, the pregnancy-related mortality ratio for Black women was 7.6 times higher than for white women. And the pregnancy-related mortality ratio for Hispanic women was 2.7 times higher than for white women. And finally, based on the NJMMRC's review, among the pregnancy-related deaths from 2019 to 2023, 27.6% were due, at least in part, to discrimination, interpersonal racism, and structural racism. It's really shocking to see these statistics, and especially in Newark, where the population is very dense. This is a problem that needs to be further addressed.
Yeah, these findings are definitely crazy and indicate that maternal mortality is directly related to pregnancy complications that can really be prevented with education and support. There are a lot of individuals that are not aware of the risks that could come with pre-established comorbidities, and as future nurses, being able to provide education and knowledge will raise awareness. Like the professional said earlier, like some of these can be really simple symptoms that people will overlook, like dizziness or fainting or a headache. But I actually found this flyer on the CDC website that comes in over 25 different languages, which is really helpful for diversity, that provides like alarming symptoms in a really simple format. Look.
Wow, Eunice, I love this flyer. This way, patients are able to voice their concerns and symptoms while the nurse is able to advocate for them. This is also specifically addressing our hot topic because we can work hand in hand with our available resources to make follow-up appointments within the community. Can someone remind me what community partners we can communicate and collaborate with before and after discharge?
Yes, let me just share my screen. So over here we have some community health centers and resources I found, and we can recommend these to our maternal patients. And with everything we learned and researched so far, I think these resources align perfectly with the Hear Her campaign, since they address all complications and concerns pregnant and postpartum women may have, as well as bridging the gap between patients and healthcare providers and eliminating any barriers that may interfere with accessing the healthcare they require. There's also resources in the area that specializes in housing, mental health, substance abuse, and domestic abuse. Also, it's important to know that Family Connect New Jersey is a free statewide home visiting nurse program focusing on improving maternal and child health outcomes. They assess the emotional and physical health as well as continuing postpartum care, and their responsibilities and goals reduce emergency department visits and maternal mortality rates.
Wait, before you guys continue, can you guys check this title slide I made for the project?
Well, guys, our free Zoom meeting's about to end, but it's really nice.